Welcome to the Career Pathway Channel, guiding nurses on the pathway to success.
Hello, great nurses. Welcome to the Career Pathway Channel, where we guide nurses on their pathway to success. Here's your career coach. On this playlist, we'll cover NUS 113 Applied Anatomy 1. This course, Anatomy 1, is designed to provide students with the basic knowledge of the structures of selected human systems. We'll move to the course objectives, which are all the topics you'll be discussing for your NUS 113 Applied Anatomy 1. So for Anatomy 1, we'll discuss 4 basic topics. Number 1, understand the structure and organization of human cell and body. 2, understand the structure of the musculoskeletal system. 3, understand the structure of blood and cardiovascular system. 4, understand the structure of the respiratory system. So these are the topics you'll be discussing for NUS 113 Applied Anatomy 1. Circles to success for all these topics. Everywhere you see red circles, they indicate that these areas are a must-know for your next examination. The orange circle indicates that these areas are good for your clinicals, and green circles ask you to skim through this video at later times. For the purpose of this video, all 4 topics for this course, NUS 113, have been put into modules. So we have Module 1 to Module 4 for NUS 113. This video specifically will cover NUS 113 Module 1. What we'll discuss in Module 1 is to understand the structure and organization of human body or cells. This is the first topic you'll discuss for your first year anatomy in nursing. For Module 1, we want to look at the specific objectives, which are as follows. In order for us to understand the structure and organization of the human body or body cells, we will discuss the following objectives. Number 1, we'll define the following anatomical terms, positions such as anterior, posterior, lateral, and so on and so forth. We'll also discuss plane and body axis. Number 2, we'll describe the basic units of the human body, such as the cell, tissue, and so on and so forth. We'll outline the cell theory. 4, describe cell division such as meiosis and mitosis. 5, we'll list the various tissue and membranes of the human body. 6, describe the characteristics of the various tissue and membranes of the human body as listed in 5 above. 7, explain the processes of embryological development and human genetics. 8, describe the body regions and cavities. 9, identify various systems of the body, such as the nervous system, the cardiovascular system, the musculoskeletal system, and of course the digestive system. Let's begin with Objective 1. Define the following anatomical positions: anterior, posterior, lateral, and also we'll discuss plane axis. Take note of this. If you mistake anterior for posterior, you might place an ECG lead incorrectly, and therefore you miss an MI. Let's discuss the anatomic terms used in nursing. Number 1, anterior. Anterior is also known as ventral. It means front of the body. Example, chest is anterior to the spine, right? The spine is at the back, so the chest is at the front. So when we discuss things at the front, the words we use are anterior or ventral. 2, posterior or dorsal. It indicates the back of the body. For example, the spine is posterior to the chest. 3, medial. Medial means towards the midline. For example, the nose is medial to the eyes. 4 is lateral. Lateral means away from the midline. Example, the ears are lateral to the eyes. 5, superior. The word superior means above. For example, you can say the head is superior to the chest. The 6th word is inferior. Inferior means below, and you can say the stomach is inferior to the heart. 7, proximal. Proximal means nearer to the point of attachment. Example, you can say the elbow is proximal to the wrist. Number 8 is distal. Distal means farther from the point of attachment. For example, you can say the fingers are distal to the elbows. These are words used to indicate positions in anatomy. As a form of summary, let's look at more explanation and applications. We'll look at some terms, the definition, then nursing application. The first one is anterior. Anterior, we have said that it means towards the front. of the body. Example, the sternum. Nursing application. Place ECG leads on anterior chest for best myocardial view. Pressure ulcers on anterior knees from kneeling. We can see how it describes positioning the ECG and the location of pressure ulcers using the word anterior. Number 2, posterior. Posterior means towards the back of the body. Example, the spine. Nursing application. Assess posterior lung sound from pneumonia. Sacral ulcers form on posterior pelvis in bed-bound patients. 3. Lateral. Lateral is towards the side. Example is the ears. Nursing application. Inject intramuscular vaccines in lateral deltoid, not near the radial nerve. Lateral malleolus fractures common in 4. These words, lateral, have been described in this nursing application. Number 4 is medial. It means towards the midline. Example, the nose. Nursing application. The carotid pulse is medial to the sternocleidomastoid. Medial meniscus tears cause knee instability. Word medial have been applied in this nursing application. Let's look at some anatomical planes. We look at the planes in nursing. Plane can also be called axis. First one we'll talk about is the sagittal plane or axis. It divides the body into left and right. You can get the question that asks you to define the following planes or list the body planes and explain. Take note of it. The sagittal plane divides the body into left and right. Coronal or frontal axis divides the body into front and back. 3. Transverse plane divides the body into upper and lower parts. An axis is a line around which movement occurs, e.g., example is flexion extension around a transverse axis. Take note of this. When repositioning a patient, ensure lateral tilt, and that means you should move towards the side. Move the patient towards the side, not the spine. This will reduce shear stress by 60%, leading to the prevention of the detritus ulcers. Let's take note of let's explain further some anatomical planes. We'll look at the term, we'll look at the definition and nursing application. The sagittal plane, we have said, is a vertical plane that divides the body into left and right. Example, splitting the body midline. Nursing application. Cardiopulmonary respiration compression equal to sagittal plane to avoid rib fractures. Midline incisions heal faster because they have less tensions. The next anatomical plane is frontal or coronal plane. It is a vertical plane dividing the body into front and back. Example, ear to ear. Nursing application. Assess frontal plane gait for balance issues. This will prevent stroke risk. Frontal lobe injuries will lead to judgmental loss and will definitely involve or result in falls. When it says assess frontal plane gait for balance issues, what it's simply saying is to look out for side-by-side movements during walking. Side-by-side movements such as hip hiking, pelvic drop, or excessive swaying will indicate stroke risk or risk of falls for the patient. Why do we need to assess this? Poor control in the frontal coronary plane, for example the Trendelenburg gait, can signal weak hip abductors, vestibular dysfunction, or neurological impairment, which may increase the risk of falls. For instance, in stroke patients, there is weakness on one side, which often causes pelvic instability in the frontal plane, leading to unsteady lopsided walking. Observing this will help you to identify post-stroke balance deficits and help also to guide in patient rehabilitation. And also it says frontal lobe injuries will lead to judgmental loss, leading to fall risk. Frontal lobe injuries will definitely result in poor judgments of the patient because the frontal lobe governs executive functions, decision making, impulse control, and awareness of danger and also judgment. If it is injured, example in trauma or tumor or even a stroke, a person may attempt to walk unsafely. Patients can just get up unassisted despite weakness. It can also, because of poor judgment, can ignore hazards. Wet floors can even lack insight into physical limitations. So there is need for balance. Balance isn't just physical, it's also cognitive. Okay? Transverse plane. Transverse plane is the horizontal plane that divides the upper and lower regions of the body. Example is the waistline. Nursing application. Abdominal assessment follow transverse plane, right? For instance, the abdomen has 4 quadrants divided by 2 imaginary horizontal and vertical lines, right? Which divides the abdominal region into various parts, which we'll discuss later. So doing abdominal assessment using the 4 quadrants, you also find that sigmoid colon is most prone to volvulus. Axis is an imaginary line for rotation. Example is spine on the vertical axis. Nursing application. Rotate patient along spinal axis during log rolls to prevent cord injuries. Objective 2. To describe the basic unit of the human body, cell, tissues, etc. Take note of this. When you assess skin tuggle, you are evaluating connective tissues health. If there is a slow recoil, that is dehydration, and there is need for IV fluid replacement. Basic unit of human body. The basic unit of human body includes cell, tissue, organ, system. A cell is the smallest structural and functional unit of life. Tissue is a group of similar cells performing a common function. Organs is a group of tissue working together. Example is the heart or lung. A system is a group of organs working together. Example is the cardiovascular systems. We look at structure, we look at the definition and how they apply to nursing science. Example, cell, which is defined as the smallest living unit. Example is the neuron and the erythrocytes. Red blood cells in ROBCs carry oxygen. If there is a low count, it will lead to fatigue or pallor. Neutrocytes fight infection. If there is a low count of neutrophils fight infection. If there is a low count of neutrophil, it will lead to neutropenic precautions. Tissues are a group of similar cells working together. There are 4 types. Of course, there is the nervous tissue, there is the epithelial tissue, there is the muscle tissue, and there is the connective tissue. We will discuss the functions at later times. Epithelial tissues help to line wounds. If there is a breakdown, it will result in pressure ulcers. Nervous tissue damage can lead to stroke or stroke symptoms. The next structure we'll talk about is the organ. It's a structure made up of 2 or more tissues performing a function. Example is the heart. The heart involves muscle plus nervous plus connective tissues. If there is a heart failure, it will be evidenced by edema and dyspnea. The next structure is the system. System is made up of organs working together. Example is the cardiovascular system. The cardiovascular system failure will lead to hypotension, weak pulse, which will require immediate interventions. Objective 3. To outline the cell theory. With regards to cell, you must understand, for instance, chemo drugs kill cancer cells, but also they kill healthy dividing cells. So there is need to monitor for mucositis, which is the inflammation and ulceration of the mucous membrane lining the digestive tract. Example is the oral mucositis of the mouth. You also monitor for neutropenia, which is abnormally low number of neutrophils. Let's look at the cell theory. The cell theory states as follows. 1. All living things are made up of cells. 2. The cell is the basic unit of structure and function in living organisms. 3. All cells arise from pre-existing cells. Let's explain further. Principle number 1 says all living things are made up of cells. How does this apply to nurses? Cancer are abnormal growths of cells. Chemotherapy targets rapidly dividing cells. Rapidly dividing cells are found in the hair and GI tract. 2. Cells are the basic unit of life. How does this apply to nursing? Antibiotics disrupt bacterial cell walls. For example, the penicillin is an antibiotic medication that disrupts bacterial cells. It has no effect on viruses because viruses are not cells, okay? And they do not have cell walls. Number 3, cells arise from pre-existing cells. For example, wound healing requires cell division. and if there is a diabetes, and also if a patient has diabetes, it will slow mitosis, and which will lead to a non-healing ulcer. 4. We want to describe cell division such as meiosis and mitosis. What is mitosis? Mitosis is a cell division process that involves the production of two identical daughter cells. For instance, growth and repairs. Meiosis is another cell division that involves the production of 4 genetically different daughter cells. Example is in reproduction. How does this link to nurses? Mitosis is important for wound healing. Meiosis explains genetic inheritance and chromosomal disorders. We want to further look at these processes, the purpose, and then their nursing relevance. Mitosis, growth or repair of cells. Once membrane. The mucous membrane are the membranes that line body cavities which open to the exterior. Example is your mouth and gastrointestinal tract. What are their functions? They secrete mucus for protection and lubrication. Take note of this. If there is a dry mucous membrane, that indicates dehydration. So oral care will prevent pneumonia in intubated, and also oral care will prevent pneumonia in intubated patients. Number 2, serous membrane. So in your clinicals, you'll be taught how to carry out oral care So in the OSCE or clinical, you'll be taught how to carry out oral care for your patients, either conscious or unconscious. Take note of this, that when you carry out oral care, you are trying to prevent pneumonia in intubated patients. Serous membrane. Serous membrane line closed body cavities. Example, the neural cavity and the peritoneum. What is the function of serous membrane? They secrete fluid to reduce friction. Where do we find them in nursing? You can find serous membrane in pleural effusion, which is evidenced by dull percussion and dyspnea. You find membrane in ascites, which is evidenced by abdominal distension leading to liver failure. The synovial membrane. Synovial membranes are located in joint cavities. What are their functions? They function to lubricate the joint. Nursing alert. With regards to synovial fluid or synovial membrane, there is arthritis. Arthritis leads to joint swelling and joint pain. There is therefore need for range of motion exercises which help to prevent stiffness. The next one is cutaneous membrane. Cutaneous membranes are found in the skin, which is the dermis and epidermis. What is the function of the cutaneous membrane? They serve as barrier against pathogens. Nursing alert. Stage 1 pressure ulcer. Stage 1 pressure ulcer is indicated by non-blanchable redness on the sacrum. There is need to therefore reposition the patient every 2 hours. Objective number 6. To describe the characteristics of the various tissues and membrane of the human body as discussed in Objective 5. So let's begin. We want to look at the characteristics of various tissues. The epithelial tissue, for instance, helps to cover, protects, absorbs, and to secretes. It can be found on the skin and the glands. Please take note of this. You could be asked to discuss the characteristics of the epithelial tissues or the characteristics of various tissues and where you can find them in the body. 2. Connective tissues. Connective tissue functions to support, to bind, and to transport. It can be found in the bone, in the blood, and in fat tissues. Number 3. Muscle tissue. Muscle tissues helps to contract for movement. It could be skeletal muscle, cardiac muscle, and smooth muscle. Number 4. Nervous tissues. Nervous tissue help to transmit impulses, such as the neurons in the brain and in the spinal cord. Number 5. Membrane tissues. Membrane tissues help to protect, to secrete, and to reduce frictions. So we want to look at the nursing application of these tissues. Epithelial tissues, the characteristics are as follows. It's tightly packed, is avascular, which means it has no blood vessels. It regenerates rapidly. Nursing application, it lines skin and gastrointestinal tract. If there is a breakdown, it will lead to pressure ulcers and aspiration pneumonia. There is need for wound care. Wound care will promote epithelialization with moisture. The next is the connective tissues. What are the key characteristics of a connective tissue? They have extracellular matrix, which is called collagen. They are vascularized and they support and protect. Nursing application, they are found in the bone, the blood, and fat. Osteoporosis happens as a result of weak connective tissues. This will lead to fracture risk. There is also edema, which means fluid in the connective tissues. The next tissue we'll talk about is the muscle. What are the key characteristics of the muscle? It contracts to produce movement. It is of 3 types: skeletal muscle, cardiac muscle, and smooth muscle. What is the nursing application? For skeletal muscle, if there is weakness, it will lead to fall risk. So the cardiac muscle, where is the cardiac muscle applied in nursing? ECG monitors muscle depolarization. The next one is smooth muscle. Where is it applied in nursing? It is applied in gastrointestinal motility issues with regards to constipation. The next tissue we'll discuss is the nervous tissues. It involves neurons and glial cells. It conducts electrical impulses. Nursing application of nervous tissues. Stroke damages nervous tissues, leading to hemiparesis and aphasia. Also, with regards to nervous system, there could be seizures. Seizures simply means abnormal electrical activities. Objective 7. We want to explain the processes of embryological development and human genetics. Embryology. Embryology is the science that explains the entire journey from conception or fertilization to the establishment of body systems and early stages of growth. So basically, it begins with fertilization, which is the fusion of the sperm cells, leading to the formation of single zygote. The zygote is a fertilized egg which begins to divide as it travels towards the uterus. Cleavage, therefore, happens after the formation of the zygote. So there is rapid mitosis division without the growth in size, and there is a production of the solid ball called morula at the cleavage stage, okay, which leads to the formation of a blastocyte. So what happens is that the morula develops a fluid-filled cavity and becomes a blastocyte. The next is implantation. So during implantation, the blastocyte is attached to and embedded to the uterus or the uteral lining, which establishes the exchange of nutrients from the mother. This will lead to the formation of the embryo. From implantation until 8 weeks of pregnancy, the product of pregnancy is called the embryo, which will lead to the formation of the fetus. From week 9 until birth, the product of pregnancy is called the fetus. Let's look at genetics. With regards to genetics, basic terms include genes, chromosomes, and inheritance. The genes are the unit of heredity carried in the DNA. We have chromosomes. There are 46 chromosomes, which are 23 pairs. Another word to take note in regards to genetics is inheritance. When we talk about inheritance in genetics, we mean dominant or recessive traits. We could also talk about mutations, which are disorders. Example, Down syndrome, sickle cell anemia are all mutations in genetics. Let's wrap it up and look for the nursing implication with regards to embryological development. So basically, we look at the stages, the key events, and nursing implication. The first is fertilization. It involves the formation of sperm and egg, leading to the formation of zygote. This is day 1. Nursing implication. There is need to give folic acid, which will prevent neural tube defects, especially in day 21 to day 28. The next stage is gastrulation. Gastrulation involves the formation of 3 germ layers, which will usually occur in week 3. Nursing implication. The germ layer leads to the formation of tissue. So the formation of the ectoderm, the mesoderm, and the endoderm. The ectoderm involves the skin and the nerves, the mesoderm involves the muscles and the bone, and the endoderm involves the GI tract and the lungs. The next stage is the stage of organogenesis, which is the formation of the organs. This usually takes place around 4 weeks to 8 weeks of age. Nursing implication. Teratogens such as alcohol, isotretinoin can cause major defects during this stage because these substances are teratogenic and they could pass through the membrane and affect the fetus. With regards to human genetics, the concept involves chromosomes. The nursing application of chromosomes, these are genetic defects such as Down syndrome. Down syndrome is caused by trisomy 21. There is need to screen for heart defects in newborns. Another concept with regards to genetics is DNA and RNA. Where do DNA and RNA apply to nurses with regards to human genetics? It is applied in genetic testing. Example is the breast cancer gene. It will help to guide cancer prevention, prophylactic mastectomy. The next concept with regards to human genetics is the concept of inheritance. With regards to inheritance, it could be autosomal dominant, which is found in Huntington disease. This poses 50% risk to offspring. So it's very important for the nurse to teach family planning. Let's take note of this. There are some basic prenatal screening that must be done at the right time. For instance, in the first trimester, child translucency can be done in order to diagnose of Down syndrome. During the second trimester, quad screenings can be done in order to detect neural tube defects. Objective number 8. We want to explain body regions and body cavities. This is very relevant for your examination. So we want to look at the body regions. Body regions include the head, the neck, the trunk, the upper limbs, and the lower limbs, which are known as the extremities. So with regards to body regions and body cavity, we want to first look at the abdominal regions. As we can see, the abdominal region or abdominal cavity is divided into various sections by imaginary lines, and there are various organs that can be found in those areas. There is need to therefore understand these various segments and the organ found therein. Let's look at the first one, the ROUP, which is the right upper quadrant. The key organ found there is the liver and the gallbladder. Nursing relevance. The right upper quadrant, if there is a pain there, it could be a signal of cholecystitis, which is called Murphy's sign, which means there is an inflammation of the gallbladder. LUQ has to do with lower upper quadrant. The organs found there is the stomach and the spleen. If there is a important thing, it could indicate gastritis and splenic rupture. This could be caused by trauma. The next one is the right lower quadrant. The organs found there are the appendix and the cecum. If there is a right lower quadrant fail, it could indicate appendicitis at the McBurney's point. The next one is the LSD, which is the left lower quadrant. The organ found there is the sigmoid colon. If there is a left lower quadrant fail, it could indicate diverticulitis or constipation. Always assess abdomen in sequence, so beginning with inspection, then auscultation, then percussion, then palpation. This is to avoid altering bowel sounds. The next we'll talk about is the dorsal cavity. The dorsal cavity involves the cranial and the spine. Ventral cavity involves the thoracic, which is the heart or the lungs, the abdominal, which is the stomach or the intestine, or the pelvic, which is the bladder and the reproductive organs. So, we want to look at some cavity. First is the dorsal cavity. The dorsal cavity, the organ found there is the brain in the cranial axis and the spinal cord in the vertebral axis. Nursing implication: if there is increase in intracranial pressure, this will be evidenced by headache, vomiting, and pushing triad. There is need to carry out a log roll for spinal repulsion. Ventral cavity. Ventral cavity has to do with the thoracic axis, which involves the lungs and the heart, and the abdominopelvic axis, which involves the GI tract and the urinary and reproductive tract. Nursing assessment. There is need with regards to the ventral cavity in nurse to assess for pneumothorax. Pneumothorax is indicated by asymmetric chest rise. Bladder scan can be done for post-void residual. Objective 9. One will explain the systems of the body. The system of the body involves the nervous system, which controls and coordinates; cardiovascular system, which involves the heart, the blood, and the vessel; number 3, the musculoskeletal system, which involves the bone, the muscles, and the joint; 4, digestive system, which involves the breakdown and absorption of food; 5, respiratory system, which involves in gas exchange; urinary system, which is involved in filtration and excretion of waste; 7, reproductive system, which involves reproduction; 8, endocrine system, which involves the production and formation of hormones; 9, integumentary system, which involves skin protection; 10, the immune or lymphatic system, which is used as the body defense mechanism. So, as a form of putting everything together, I want to look at the system, the key structures, the nursing assessment and nursing focus, and lastly, we'll look at the high risk complication. With regards to the cardiovascular system, the key structure in the cardiovascular system is the heart and the blood vessels. Nursing assessment: nurses check pulse quality, capillary refill, and jugular venous pressure. High risk complications could involve in heart failure resulting in edema and crackles, which is evidenced by low saturated pressure of oxygen, which is an SpO2 lower than 94%. The next high risk complication with regards to cardiovascular system is the DVT, deep vein thrombosis, which is evidenced by unilateral leg swelling. The next system we look at the respiratory system. The key structure of the respiratory system involves the lungs and the trachea. Nursing assessment for the respiratory system involves the respiratory depth, respiratory rate, the lung sound, and SpO2. High risk complication with respiratory system involves the COPD, which is chronic obstructive pulmonary disease. It is evidenced by barrel chest and paused lip breathing. There could also be pneumonia with regards to respiratory system, evidenced by fever and productive cough, which is formation of mucus as cough goes on. The next system we'll look at is the musculoskeletal system. The key structures in musculoskeletal system are the bones and the muscles. Nursing assessment for the musculoskeletal system involves the gait, the balance, range of motion and joint stability, and assessment of skin over bony prominences. High-risk complications with regards to musculoskeletal system involve osteoporosis, which is evidenced by high fracture risk, and also compartment syndrome, which is evidenced by pain, pallor. The key structure for the nervous system include the brain and the spinal cord. Nursing assessment for nervous system include the gastrocoma scale, which you will be taught later, the GCS scale, the pupil response, and motor-sensory functions. High-risk complications with regards to nervous system include stroke. With regards to stroke, there is need to understand the FAST acronym. The FAST acronym: in stroke, there is face drooping, there is weak arms, there is sluggish speech, and there is need for the nurses to act very fast. If not, there could be brain cell damages. With regards to the nervous system, another high-risk complication is in seizures. Seizures, there is need for airway protection. So when there is a seizure, all you need to ensure as a nurse is to ensure the patient is safe, take the patient to a safe area, ensure that the airway is patent, the airway is open, so that the patient can recover. Or you can also place the patient in the recovery position at the lateral side as the patient lies. Take note that there is no need to put a spoon or any object in the patient's teeth or in the patient's mouth. Just put the patient in the recovery position and ensure that there is airway patency for the patient. The next system is the digestive system. The key structures in the digestive system involve the stomach and the intestine. Nursing assessment for the digestive system include assessment of bowel sound, assessment of abdominal distension, and stool characteristics. Take note of this high-risk complication. Bowel obstruction is evidenced by vomiting and no bowel movement. Also, with regards to the digestive system, there could be peritonitis, which is evidenced by a rigid abdomen and gagging. As I round off, let's look at the circles to success. These are areas that are very specific for your examination. Ensure to practice the axis of the body. Know how they are described. Also take note of the abdominal cavity. You could be asked to draw the abdominal cavity and describe the organs that are found in those areas. Green circles ask you to skim over this video at later times. Ensure to go over this video again. Make sure it is well understood. Answer these questions in the comment section. Question number 1. Right upper quadrant, during abdominal assessment, there is pain. What does this suggest? What organs are found at the ROUQ? Question number 2. Which tissue regenerates the fastest? Let me hear your answer in the comment section. You don't just see a patient, you diagnose with anatomy. When you assess capillary refill, you are evaluating cardiovascular system integrity. When you prevent pressure ulcers, you are protecting epithelial connective tissues. When you recognize stroke symptoms, you are mapping nervous system damage. Master anatomy, and you turn every assessment into life-saving interventions. Take note of this. Pressure ulcers start in epithelial tissue, but they progress to the connective tissues. When pressure ulcers, which is also called bed sore or decubitus ulcer, if it has resulted to connective tissue damage, that is stage 3 pressure ulcer. Early intervention can save the life of your patient. With this, I want to say a very big thank you for staying tuned to the end of this video. If you have not subscribed to our YouTube channel, kindly subscribe, make comments in the comment section. Let me know how you feel about our videos. Till we meet again in Module 2, it is goodbye from the Career Coach. Bye.
The Career Pathway Channel, guiding nurses to success.